The following segment is sponsored by Capital Caring Health. Today we are learning about a tough but important topic for families, hospice care. I'm joined now by Steve Cohn, Chief of Communications and Philanthropy. And Steve, I understand 2022 is Capital Caring Health's 45th year of providing hospice care. Can you share a little of the history at Capital Caring Health?
Kid, very happy to. So way back in the late 70s, our CEO, Tom Consumpus, and a number of other people, including Senator Bob Dole, who, as many people know, many viewers know, just passed away, they were instrumental in getting the hospice care legislation passed in the United States. And in 1977, Capital Caring Health started providing hospice care, and we were the first in the nation to do that right here in the DMV.
Oh, that's absolutely incredible.
Oh, and also, we were the first in the nation to open an inpatient hospice center in Arlington, Virginia in 1982.
I want to talk a little bit more about that. You know, we hear going into hospice care. When we hear that, does that mean that someone's always going to a facility?
95% of the time, we go to them. We have a core team which includes a physician, several nurses, a social worker, and upon request, a chaplain. And 95% of our care is done in the patient's home or wherever they reside. 5% of the time they need our inpatient care, and we're the only hospice organization in the DMV that has an inpatient facility in Northern Virginia, and we're the only one with a facility in Washington, D.C.
Now let's talk about the families. This can be such a difficult time for families, but how long can someone be in hospice care, and how is the family affected during this time?
Yes, so the hospice benefit for everyone who lives here in the DMV, regardless of citizenship status or ability to pay, the hospice benefit is for 6 months of care at a minimum, and longer if necessary. And it also has been proven, hospice care is proven to not only extend the patient's life, but also provide much better quality time for the patient and their loved ones, because they don't have the stress of trying to do this on their own. They don't have to call 911. They don't have to get rushed to the hospital. We come to them, we take care of them. It's not just about the end of life. It's about a much better life for the patient and their loved ones.
Better life for the patient and the loved ones. I think that's important. What's the biggest challenge you face when it comes to educating families about hospice care?
You know, kid, the tragedy, as I see it, is that here in Washington, D.C. specifically, people of color don't really embrace hospice. Maybe they don't know about it. I hope your viewers will spread the word that hospice care is carefree for families in Washington, D.C. Washington, D.C. has one of the lowest hospice utilization rates in the nation. It's terrible, and it shouldn't be that way. We are here for you. We take care of you. We extend the life of the patient, provide much more precious time for them and their loved ones. It's a way better life. It's a way better end of journey for everyone. And we hope people embrace our care as we embrace them.
Such important work, and we are here for you, you just said. How can our viewers at home learn more?
Yes, they can come to capitalcaring.org, where all of our information about hospice is readily available. And it also has our phone number that they can call 24/7. We operate 24/7. We never shut. We're always there for you, for anyone, regardless of race, citizenship status, or ability to pay. And we rely upon donations too, so thanks for anyone who wants to help that way.
Steve, thank you so much, and such important information.
Sure thing, kid.
Thanks so much for joining us.